Over the last 5 years, NIHR CLAHC for Northwest London has built a strong foundation of practical and academic expertise in the translation of research into practice. Our aim is to enhance quality and value of care, promote the importance of patient experience, and support the improvement of health outcomes.
The translation of research into practice and the development of academic improvement science expertise is critical to Imperial College's ambition as an international centre of excellence, redefining medicine and health for enhanced patient care. CLAHC very much acts as a broker across Northwest London, bringing together our academic faculties with healthcare organisations, patients and industry. This empowers these stakeholders to play a critical role in the NIHR pipeline.
Healthcare is complex, involving different individuals, professions and organisations, and influenced by multiple sources of research evidence, guidelines and policies. The effective implementation of research into practice requires rigorous processes of investigation and flexible infrastructure that recognises context and fosters an ongoing culture of improvement. We need to focus on what actually happens between frontline professionals and patients. We developed a systematic approach that brings together patients, healthcare professionals and academics to work scientifically and use a suite of quality improvement methods to deliver measurable and sustainable benefits. This wasn't straightforward. At first, frontline staff and patients were unsure about using elements of the systematic approach, and teams used the methods with varying levels of success. So we worked with the teams to transform the methods and ensure that they were both useful and relevant. Our research shows that quality improvement methods help frontline staff translate research into practice. The methods, when applied with high fidelity, provide powerful communication tools and promote reflective practice. To support spread and increase the scale of this approach and ensure more consistent delivery of improvements, there remains a need for greater scientific inquiry into the theory and practice of quality improvement. This includes the application of the tools and methods in different healthcare settings, education and technical resource to embed their use, and how to create a supportive environment and culture of improvement. Getting this combination right can be transformative, delivering real change and inspiring innovative ways of working.
I was involved in a project to improve medicines management. Patient confusion about medicines is a huge problem for patients and the NHS. Lack of shared information leads to medication errors, and increasingly patients want to take greater responsibility for managing their own care. Patients came up with the idea of a medications passport, which they or their carers can easily carry to all of their healthcare appointments. With CLAHC's support, my medication passport is now a reality.
Our research shows that patients can be powerful change agents, connecting organisations, sharing knowledge through social networks, and challenging underlying assumptions held by healthcare professionals. Working in this area is both challenging and exhilarating for all involved. Imperial College Business School research indicates CLAHC has a shared identity within Northwest London. Success factors include the ability to listen, respond and adapt the programme, combined with a consistent vision of empowering staff, patients and academics to deliver improvements. These factors underpin our CLAHC proposal. The delivery themes have patients at their core and resonate with the healthcare needs of patients and population across Northwest London. Our frailty theme aims to promote person and carer-centred health and well-being in the elderly and other frail groups. The theme evolved from our work with medicines management in the elderly towards a more holistic view of frailty, including patients' physical and mental well-being and their environmental and social care needs. Our breathlessness theme integrates our disease-specific work in COPD and heart failure, where we have improved outcomes and patient experience. The theme will explore common symptoms and treatments with the aim to further improve the assessment and care of breathless patients. The early years theme aims to promote a healthy start for lifelong health and well-being. Work will build on allergy care pathways to consider how this approach can be implemented for other conditions and how local services can best be configured to meet the needs of younger people. The cross-cutting themes provides the research infrastructure for our systematic approach and are constructed to support the delivery themes to translate research and evidence into practice at pace. Our programme is designed to be iterative, driven by real-time research and evaluation. This will allow us to achieve our aims, to generate new knowledge, to build capacity and capability, and to deliver measurable and sustainable benefits in health and care for both the population and individual patients.